morning, everyone. I know we still have some folks that are joining as we speak, but I wanted to kind of get started because we have a packed agenda today. So lots of updates and important presentations. So it's great to see you all. Most of you all already know me, but for the new faces on our call today, I'm Helen Goa from the Office of Community Affairs, and this is our monthly COVID-19 outreach partner meeting that we host in partnership with Thrive Alliance. And Kirsten from Thrive is here with us today as well. So we have a packed agenda today. First, we have a guest from NovaWorks who will give us a quick overview of their job training programs and resources. Hopefully this is helpful for your respective communities, especially during our recovery efforts. And then Dr. Chan, our Deputy Health Officer, is going to give an update on our current COVID-19 status within our county. And after that, Trish Irwin and Laura Shee from our Vaccine Operations Unit are going to give an update on our current vaccination efforts. After all that, I'm hoping we'll have time for questions and answers. So during the presentations, if you have questions that come up, please also feel free to put them in the chat. That way we can have them lined up for our experts. And finally, please do stay tuned until the end. We do have a final update regarding contracts as well that we'll announce at the end of the call. So without further ado, let's dive right in. We have Cindy Stahl from NovaWorks with us today. Welcome, Cindy.
Thanks, Helen. Thanks, everybody. It's nice to virtually meet you. I am Cindy Stahl. I'm our Job Seeker Services Manager for NovaWorks. And I'm going to share my screen. Let's just do this slideshow. Can everybody see that? Great. Go on to the next one. So NovaWorks, we are a workforce development provider. We provide services in both San Mateo County and the northern part of Santa Clara County. So we've been in Santa Clara County for over 40 years. And in 2015, we started working in San Mateo County. So we do have two job centers, one in the city of San Mateo and one here in Sunnyvale. We have over 35, close to 40 years of experience in job search and career navigation, and we help people transition to new job opportunities. And here's a list of just kind of folks that we see in different stages. They've been laid off, maybe they've quit their job, been let go, they left the workforce for a while and are trying to re-enter. We work with immigrants and refugees, people that might be working but looking for better opportunities, wanting to make a career change, and seeking promotional opportunities as well. All of our services are available at no cost to our customers. This is our career navigation curriculum. So it's, and I'll go into a little more detail in a couple of slides, but this is really the basis for everything we do with our customers. So we really meet them where they're at. We do all kinds of things around career focus if they don't know what they want to do, help them with resume and application preparation, do job search and networking services and workshops, and then prepping for interview and negotiating offers. Our career advising is really the core of what we do. We've got a great team of advisors here. They help people define their career goals. We do a lot of career research for people, again, if they're not really sure what they want to do, exploring training options. Many of our grants have training. We've got free licenses for things. So almost anybody, if they're interested in some kind of training, we can help with that. We do lots of resume writing, applications, LinkedIn profiles for people. We've got a number of workshops that do that. Help people just all around all the job search. It's really hard to job search, so it really does need a lot of attention, and our career advisors can really help with that. We do practice interviewing, strategizing salary negotiation again, and job retention for people. We have over 25 workshops, and these are the areas that we have. So each of these, career focus, resume, all have multiple workshops tied to that. Our workshops are done via Zoom right now, but if somebody does not have access at home to Zoom, they can go to either our San Mateo Job Center or to the Sunnyvale location, and we have computers that they can come here, log on to the Zoom, and do the workshop, so they can still attend those, even if they can't do it from their home. We have a business services team and lots of employer connections. We have our own job board on our website, and all of the jobs posted on there, we vet with the employer, so we know they're real jobs. We know the employers are looking for those candidates. The active recruitments, we get a little more intensive with our assistants, and we actually get resumes from our job seeker customers, help them customize it for that active recruitment, and the employer is asking us to vet that, send it to them, and hoping that we make that connection and that at least an interview for somebody. We offer employer spotlights and information sessions. We recently did something for Samtrans in San Mateo County and had great attendance there. So we're always looking to highlight employer opportunities for job seekers. And some of those will even open up to the general public and not just do through our members in our job centers. And then we do recruitment events also where they actually will meet, maybe review processes for hiring. We actually have one, I think, going on today. Robert Haft is a staffing agency, and they will actually be looking for resumes and potentially interviewing people during the session. And this is a little bit more about my plan. Let me see if I can get to here we go. So this is really the basis for everything that we do. This is on our website here. So it's open and free to the public. And a lot of our partner organizations use it with their own customers if they maybe aren't interested in fully registering with Nova. So we go through all the stages of the job search, and each stage of the job search, we really meet people where they're at. So let's say they really are not sure what they want to do. If we start in that focus stage, the website has all kinds of tools. I'll click on the career assessment. So if somebody is looking to decide or figure out what they want to do next, this includes links to all kinds of assessment tools that they can use. They can work with our career advisors through that process. We have, I was just going to look, no, that's not going to go there. Let's go back. Some of the sections have videos included that talk about parts of a resume, and walks them through different development parts for that. So there's all kinds of tools here. I strongly encourage you to maybe take a look at it. We're happy to even provide some training for staff. Obviously, we want people to come to us if that makes sense, but if it doesn't work for them and they want to just work through another organization, this is all available to you as well. Can you see the slide deck again? So we're funded, and we have ongoing funding, and we're a workforce board that serves, again, both the northern part of Santa Clara County and San Mateo County. We have a special project that we're also really looking to recruit job seeker customers for. We're funded with the county for some ARPA funds to serve 25 residents from historically excluded communities. So we have a list of zip codes in the county that they're asking us to prioritize. We're partnering with local organizations for recruitment and outreach. We're calling it the whole person approach, and it's really about saturating a job seeker customer with really everything they need to be successful. So we're helping, we're identifying individuals that are eligible. They do need to be somehow impacted by COVID in order to be served in the pilot. And then we're assisting with career exploration. We're putting people in training programs. We're helping with support services. We just approved some rental assistance for somebody that'll probably get that for about 4 months while he's in training with us. So there's a whole host of things we can do to really help somebody be successful. And what I want, I guess, for all of you to know is we are focusing on the pilot for the 25 residents, but all of the other things I just talked about are available to all job seekers. So we really want to make sure that regardless of enrollment in the pilot, people are eligible. So we don't want you to have to figure out if they might be eligible for our ARPA pilot program or our other services with our other grant funds. We want to help people if they are looking for employment opportunities and they need assistance. We want them to get referred to Nova, and then we'll figure out on our end which grant they're eligible for. And if they need support services and they're not eligible for the pilot, we'll find other ways to pay for that for them. So this is just a little bit more about the whole person approach. I talked about it already a little bit. So we're really looking at the individual and trying to figure out what are all the supports that they need in order to be successful and really change their life and their family situation, so that, you know, hopefully if it's somebody that either hasn't worked in a long time or they're working 2-3 jobs just to get by, that we can get them in a better place where the job is more stable, they have a career path and growth opportunities, so that they're not having to continue to struggle. We're removing barriers through our support services. Again, we've got training options available. We do transportation assistance, housing, childcare, and we're paying just basic bills for them, internet bills and other things to help them. PG&E, all of those things we can do with our funding. We're asking for referrals to go through our career advisor, Kim Pham. She's the primary contact for our whole person project. If they contact her and for some reason they're not eligible for the pilot, we will get them referred and get them into our other program. And so again, I don't want you to have to worry too much about that, but Kim is ready and waiting for referrals. And I can share this deck with you and you can send it out to the group if you want to do that. That's what I have. I don't know, Helen, if people want to ask questions now, do you want me to stay on and wait till later, or whatever works best for the group?
Thank you so much, Cindy. I think we have time for maybe like 1 or 2 questions. Do we have any folks that have questions?
Yeah, I'm very interested in all the services, since we're Support Life is serving a lot of the Afghan refugees in the entire Northern California, actually, and Central California. So in any given day, we're referring folks, and I'm very interested in what you're doing, because that's part of the package of things we do. Maybe we should talk afterwards.
Absolutely.
Leave your contact. I would be very appreciative.
Yeah, I'm happy to share. I'll put in the chat my contact information too, and you can reach out to me.
Thank you, Cindy. And I know Henrietta also has her hand up.
Yes, I do, Helen. Thanks so much. Cindy, how much does your organization work with employers to find the right candidate?
Yes, so we have a business services team that works with employers every day. So you know, we do it in various ways. As I said, we have the job board. So we have our employers posting jobs on the job board. We're doing what we call the active recruitments, where we actually are, we're taking the opportunities that an employer has. They're asking us to vet our job seeker customers. So we're helping with resume and interviewing preparation, and then we're making the referral. So we're doing that all the time. We're not a placement agency. So we're, you know, it's not, we can't guarantee a placement, but we're doing everything we can to prepare the job seeker themselves for opportunities of relationships we have with employers, and then also making sure that they know what's available. How do they do their own networking to find opportunities? There's a lot of jobs out there right now that are going unfilled. That being said, employers haven't really changed how they think about hiring. And so it still is very difficult to get through a hiring process, honestly. So we're here to really help through those different stages.
Is this part-time as well as full-time?
Yes, we do. Yes. Yeah, we can help with both, looking for part-time and full-time employment. I would say the majority of jobs on our job board are full-time jobs, but if somebody's only looking for part-time, we can help them with that too.
Thank you.
And I see Caesar has a question. This will be our last question. So if anyone else has questions after this, please put them in the chat for Cindy. Caesar.
Thank you. Hi, Cindy.
Hi, Caesar.
Thank you for your presentation. I work with the Multicultural Institute, sorry. I work with the day labor community in North Rocks and domestic workers. So my question is, do you work also with undocumented community members? Are your services open to them? That is the first question. And the second one is, your trainings are also available in Spanish?
Okay.
And the third one, sorry.
No, that's okay.
Taking advantage of your, and the third one, if you help people guiding or something about getting professional licenses? You know, like a painter license or electrician license, that kind of thing. So
Okay, so let me hope that I remember all your questions, Cesar. So first question, as far as undocumented individuals, we do need to be able to verify their I-9 right to work for the funding that we get. That being said, we are partnered with Renaissance Center, a couple of other organizations up in San Mateo County. So we're trying to make connections for those that wouldn't be eligible for our grant funded programs. The training, so our workshops and our career navigation, we can offer some of those in Spanish. We have our workshops are done on Zoom, so there's translation that can happen for somebody. And we also have staff that are bilingual that will meet one-on-one with job seeker customers that do speak Spanish and can help them. Did we lose Cesar? Can you still hear me?
yes, sorry.
Oh, okay. I'm sorry.
I'm sorry
It looked
with my
like you had
Wi-Fi.
frozen, so I wasn't sure if you heard what
Yeah,
I
I
said.
was. Sorry about it.
Oh, no. Did you hear everything I said? I'm sorry.
The first part only. So you was talking about the workshops in Spanish.
So we do it on Zoom, and so you can do translation on there. What we normally do with somebody who, if they're monolingual only, we tend to have them work directly with our career advising staff that are bilingual, and they can help them. So we have a couple of staff that speak Spanish, and they work with folks that are primarily Spanish speaking, if they're more comfortable. And we can do a variety of things, even through content in our workshop. We can do one-on-one with customers. As far as the certifications or licensing, we definitely know what, we don't do them ourselves, but we have partnerships like with the apprenticeship programs. Some of the things you mentioned about painting and other things might be work that would be done through the unions, the labor union, so we can connect with the pre-apprenticeship programs. Again, we don't do the training ourselves, but we have connections with either schools or organizations that do training and provide those certifications, the community colleges, and we can connect them and in some cases pay for the training and the certifications for somebody.
Thank you, Cindy.
Sure.
Thank you so much, Cindy. This is fabulous information, really important information. If you send us the slides and we can share it to the group later, and we'll also share the contact info and the referral info as well.
Perfect.
With the group. I'm seeing that Lisa is asking if there's a flyer in English or Spanish. So
I will send
if you could send that, that would be perfect. And I can share that with the group as well.
Great.
Thank you so much. If anybody else has any other questions for Cindy, please feel free to drop them in the chat. And Cindy, you're welcome to stay around for the rest of our meeting if you have time.
Okay, I will. And if there's questions, I can answer them in the chat. So
thank you, Cindy.
Thank you all. It was nice meeting you.
And now I'd like to move it over to Dr. Chan for a COVID-19 status update.
Hello, everybody. It's good to see you all. I'm trying to share screen. You just asked me for a Scratch update. I'm trying to not do a Scratch update. Okay. What screen am I sharing? Does it say key points of?
Yes, we see key points.
Okay, it should say key points for OCA Community Partners, but thank you so much for bringing us together again. It's another very difficult time for us. Not only do we have the surge of COVID, but we had a real horrible murder of 19 children and 2 teachers in the previous days. And I know that all of our hearts are full of sorrow, sadness, and anger. And it's really good for us to be here together just to think about how we can help our community. And forums like this do inspire me to hear all the great work that you all are doing, and look forward to collaborating with you more in the future as well too. And yesterday was also the 2-year anniversary of George Floyd's murder as well too. So it's good that we're all here together to, create more justice in this world. So with that, I have 18 slides. I'm going to fly through them in 10 or 15 minutes to give Trish's team some time, and then afterwards we'll be able to discuss together. All these slides I'll send to Helen right after we speak. So all these resources will be available for you, and also the links. So 3 main points. We are in another surge of high case rates. What this means is that all the community members that you've seen that want to wait a little bit longer because they think COVID is going to go away. COVID is not going to go away. Every 4 to 6 months, we're expecting these types of surges. The second point is right now, community transmission is high and increasing. Will probably increase for another 3 to 4 weeks or so and stay pretty high. So we're going to describe this transmission prevention triangle that you all created several months ago. We need to utilize it again. And if you're infected or symptomatic, isolate and test. We've talked about this before, but we're going to highlight a second T, which is treatment. The third main point is, again, it's really important, and we're really grateful for all of you to help your community understand the risk they're experiencing and how to balance the risk. There's only so much that the feds, the state, the locals can do. So we're really grateful for you to provide your honest feedback, criticisms, and suggestions whenever we're presenting anything and ask difficult questions. Like I said, this PowerPoint is available. We're going to send this out afterwards, and you should really feel free to. There's a lot of resources available, but to the CDC, from the CDC, CDPH, and County Health. You should feel free to utilize them, adapt them freely. If you have any questions, feel free to email me about how you can adapt any of those resources or messages. And as you know, we're not in a era of state and county restrictions or requirements. Now it's really the time for individual, could be transit agencies, school districts, to make their own policies that promote health, such as mask mandates. So that's what organizations are doing across the country and across the Bay Area. And we want to empower you to provide the right information, accurate information, and also advocate for better health. So this is the epidemiology slide, and you can see the case rates are increasing. So we look at case rates, and you can see we're right here. We don't have the latest week because of the lag in reporting, but it's continuing to increase. It's much higher than the Delta surge that we experienced last July, and it doesn't look like it's quite as high in terms of the number of community transmission as in December and early January, the Omicron surge. But it's in actuality probably almost as high, because now many people either don't get tested or they use rapid antigen tests, which are not reported to the health department. So in actuality, we think this is 2 to 5-fold higher, or 2 to 10-fold higher. So there's a lot of people getting infected right now. You're probably hearing of friends and families who are getting infected. And you can see it's much higher than the previous winter when we experienced all those deaths. The hospitalizations are increasing in San Mateo County as well as the Bay Area and California. And we expect hospitalizations to increase through probably around the end of June. And it might actually put California in like this highest level of risk. And California is thinking about doing mask requirements right now, but they're not quite at that stage yet. So one thing to know is that, at the same time, we don't want you to, for your community members who are vaccinated, we don't want to create unnecessary fear as well too. We want family members to be able to, who are elderly, if they've been vaccinated and boosted, that they should feel some comfort in attending important events, such as there might be weddings or graduations that a grandparent would want to attend. It's important to understand that vaccinations are still very, very protective against severe disease. And those who are not vaccinated, still remind them getting a vaccination is still more protective than actually getting infected. So we still highly encourage people to get vaccinated. It doesn't look like we're going to be mandating vaccines anymore. So it's all about, what we can do to protect ourselves and those who we love. And this is one of the models. We see a lot of models, but this is a composite of the models. And you can see the ensemble projections. It shows this gradual increase until about June 9th. And it's still going to stay steady throughout, June and probably through, might even see a peak when people start vacationing and having July 4th parties. So we're going to be at this high level for several more weeks or maybe even a couple of months. This is a slide that I showed previously, but I just kept it in here for the PowerPoint so that you can utilize it. I think it's a really good summary that, before we thought that vaccines are going to prevent infections a lot, but vaccines, they do prevent against infections, but they don't protect like 20, it's not like 20-fold. At one point when the vaccines came out, we thought that it would be 20 times more effective. But basically, because of both Delta and Omicron that are more infectious than Alpha, it doesn't prevent against like transmission and just infection that much, right? Like you could still get infected, but you're just not going to get severe disease. You could still get infected. You could still transmit to other people. What it does is it really is protective against severe disease. These are the official CDC recommendations. We're now in yellow. I'm just putting this up here just to remember, if you are at high risk for severe illness, talk to your healthcare provider. And basically, if you are at high risk for severe illness, I would recommend, if you're in a crowded space with poor ventilation, wear an N95 mask. So of course, we talked about the vaccines, and Trish's team, Trish and Laura are going to talk about the importance of testing as well too. We described this in a previous, I think in February and November in these OCA meetings about this utilizing the effective reproductive number, R naught and RE. And remember, RE is really a factor of how much a virus is going to be transmitting is really the aggregate multiplication of the number of contacts you have in the 2 days, within like the 2 days of you developing symptoms onward, the probability that each time that you're in contact with somebody, let's say in a room, you're going to get infected, the infectious period, and the population susceptibility. So these are the main principles. I'm not going to, just in the interest of time, I'm not going to go over again, but putting this back in the resource. And these are the interventions that actually can modify, for example, the probability of each contact getting infected if somebody's symptomatic. It means if both people are wearing a mask, you're less likely. You can reduce that probability of infection. So we talked about utilizing these main factors here in context of the winter surge and in context of the variant. And I think Cecilia's here. I think we emailed about this. And remember, this is that point of that Omicron and these variants of Omicron. What we know now is a small amount of virus airborne is causing infection. It doesn't require a large dosage of virus, much more infectious than what we experienced from March until July of 2020, that first wild type. The small amount of virus airborne is causing infection. So, and this is extremely transmissible, right? So these are the overall principles, and you could utilize these for how you engage with your community. And when we put these things together, this is how we came up with, this group here came up with vaccinate for all, because this virus is going to be either endemic and there's also future variants. or for this triangle of prevention, to prevent transmission, you want to limit the number of contacts. You want to increase indoor ventilation or be outdoors. You want to wear a mask. This is preventions in green. And in red, once you become symptomatic, you want to isolate and you want to test. So Helen and OCA and Megan put together these new infographics and flyers to describe that concept here. Here's the LIMITT, and these are all in draft form. We'll get back to this. I want to make sure we leave enough time for Trish and Laura first, and but we could take a look at this here, and hopefully this reinforces, this vaccinate is, we're so grateful for, again, the COVID response team to make sure that vaccinations are available. There's the right amount of information about how to get them, where to get them, as well as testing as well too. And you could see here, this is that triangle of prevention. We realize that you might need to go to some events in which there might be a lot of people. And if there's a lot of people, then you need to increase these two areas. You really want to make sure there's tons of ventilation then. And if there isn't tons of ventilation, you want to wear a mask. So all these things are dependent upon there. If there's not a lot of people and you have a lot of ventilation, you probably don't need to wear a mask. So this is the concept of the triangle of prevention. So, and I'll talk about this so I think either Alberto, Trish, or Laura would talk about testing, and they'll talk about treatment as well too. So here's another visual, just larger for you if you need it. So we created these slides back, I think, in November of 2020. And again, it's the same concept, and I'm grateful for you all reminding us that the community still doesn't get it. It's really not from like contaminated surfaces. It's really, if you're in a small room with poor ventilation, these droplets are airborne, and they increase when people talk, shout, or sing with each other. So we're probably going to need this. We're probably not going to say more, always wear your mask, because we created this when there was those mask mandates. So I'm like looking at Helen, like, okay, we could tweak these a little bit. But it's probably going to be like, wear your mask to prevent spreading to others and to protect yourself. And we have these resources in Spanish and Chinese as well too, as well as these resources about ventilation in Spanish, Chinese, and English. And also these slides to describe how important ventilation is. Again, if you turn on your HVAC full blast, you have a strong filter, or you even open a window, you could dramatically reduce the number of aerosolized particles in any room. It could be a household room for a party in a house, or in a social event, or even a workplace event. I mean, it's still the most shocking thing I see. I mean, when I do attend maybe some in-person meetings, maybe twice a week now, and that people don't open the windows and don't have the ventilation on full blast. So you could do a lot by just opening a single window. And of course, if you have the HVAC constantly on, you buy basically a pretty normal MERV 13 filter, you can reduce the amount of particles by 93 to 99%. So it's really important. I'm not going to go into these details about the indoor ventilation tips, but these are some resources that you and your promotoras can use, and some more visuals. One thing about treatment is, so I think Paxlovid has been available since around January. At that time, the treatments were just in production. Now it's widely available. This is a 5-day course of antivirals taken twice a day. It reduces the likelihood of severe disease by 90% among people with pre-existing moderate to severe health conditions. So these are still the same high-risk health conditions that CDC always cites. And the high-risk health conditions include older age. So it's important these are the websites on the CDC that you can read more about it. It's still pretty complex to really understand medication. So the most important things for people to understand, for promotoras to understand, is that when somebody develops symptoms, particularly if they're older or they have significant medical conditions, they should talk to their doctor right away. Many healthcare providers can prescribe the medications over the phone now. If they've had a rapid test, there are some test to treat options in 3 pharmacies in San Mateo County, and the test to treat options that are done by the state are being more and more streamlined. But I think for me and my family, I would recommend talking to their doctor. The doctor could prescribe it to there's over 50 pharmacies in San Mateo County that have Paxlovid in stock the last time I checked. So, and there should be plenty of supply. More to come about these treatments, because we're going to be needing to understand these treatments for the next few years probably, but just want to give you another update about Paxlovid. So that's my time, and want to turn it over to Trisha's team.
And I just want to make a note, could we save all questions for after Trisha's team's updates? So hopefully if you have a question, you can feel free to put it in the chat, and that way we can get them lined up.
Hey, good morning, everybody. I'm not sure I know all of you. Some of you, my name is Trish Irwin. I am the manager for the COVID response unit that is covering all vaccine and testing in the county. All our vaccine and county affiliated testing and vaccine sites. That doesn't include all multiple other places people can get testing, or et cetera, other services related to COVID. So a few things just to update you on. Curtis already touched on quite a few of them, so I won't repeat some of what he's already said. But in terms of vaccination and testing, and then we have created sort of community one-pagers that are focused on kind of trying to give a high level view of what we're seeing in specific communities. So I'll have Laura, who's on my team, do that in a few minutes after I just go through a couple highlighted points that Helen had asked us to address. So right now there are approximately six or eight standing clinics, what I call standing clinics in the county for vaccinations. Those are offering all 5+, including 5+ boosters now. That was just coming out of the CDC or FDA last week to have a third shot for the 5 to 11-year-olds that previously got the 2-dose regimen. So all of our clinics that we're providing are all offering all of the vaccines, Moderna and Pfizer. Janssen is no longer recommended, so we do not have those at our clinics. In addition, of course, you can get this at your PCPs. You can get a lot of these. You can get the vaccines at a lot of the different pharmacies throughout the county. So we're not the only one. It's just that we do continue to have the sites. And we continue to do pop-up sites as requested around the county if there's particular demand and need for in a particular community, or we want to target a particular community to do vaccinations. Also covering congregate and homebound vaccinations as well, because those are really important populations to make sure that they're actually getting all the booster that they need to do. In terms of right now, where we're at in the process is because we are where we're at. So we're actually really trying to look at what our public health priorities are in terms of vaccinations. And I'm meeting with a policy group internal to public health, family health, to try to create these guidelines that will be like, what do we actually see from a public health perspective in terms of what's serious, who's at risk for serious illness and death? What about health disparities in terms of race and ethnicity? And then in that framework, who and how would we prioritize the populations we think we should be working on? So as we continue to work on that, we'll share that with Emma and her team in terms of then also kind of helping to filter that to you in the community in terms of what we see as the priority populations and how we can develop some specific targeted outreach around the different communities that are still lagging in terms of vaccinations. Overall in the county, we obviously have a very high vaccination rate, but we still see disparities in the communities that you would expect throughout the county. So we're working on that. We're waiting on in next month, which is next week, but it'll be mid-June or so. The federal government is considering additional vaccines. So There's an additional 18+ vaccine called Novavax, which is again not an mRNA vaccine, but more similar to a traditional vaccine. So we'll see what if that comes along and if we end up using that within the county system or not. And then also, of course, the last sort of age group that is coming along, which is the under 5s. So right now, the advisory committee at the federal level is scheduled to meet the week of June 14th, I think, or around in that timeframe, 13, 14, 15, to consider both Moderna for under 5s as well as Moderna for 5 and above, which they have not previously done. So Moderna moving into the pediatric vaccination population, and then for Pfizer to go for under 5 years old. So as a county, like we do pretty strongly believe that those under 5s really should be, through a pediatric provider where the parents and the caregivers can really be talking with the pediatrician or their pediatrician about, just any concerns they might have and things like that. But we will be providing some small support to some sites where those children under 5 do gather, like early Head Start or daycare settings or like school-based daycare settings. At this point, we're probably going to be targeting ones that are year-round because the school year is quickly coming to an end. So the schools that might have been open last month, no longer will be after sort of June. So once we get those approvals for the under 5, we'll be working with our small PCPs that maybe aren't managing the COVID vaccine themselves, and then we'll also be working with, like I said, our early Head Starts and other locations to try to like do smaller kind of focus clinics that could be around that under 5 population. And then obviously at any site that we set up, we would also offer the over 5 and boosters, et cetera, for any age population. So we'll continue to do that. So that's the next sort of age group that's coming in terms of vaccinations. For testing, again, Curtis has mentioned this already. So the state LHI OptumServe sites that are our testing sites within the county all began offering Test to Treat on site as of about I think this week is actually they're all fully operational. So there's 6 sites currently. And we are working to get an additional site in South County because just how COVID testing rolled out at the time it did, a lot of the LHI sites ended up in the mid-North County. So we're getting some additional days down in South County as well. And that process is antigen test, telehealth visit right on site there, and then you actually leave with the Paxlovid if you qualify for it. So it's all right there in terms of one-stop shop. We did just learn this morning that all of the curative sites within the county also do Test to Treat. They still utilize the PCR test model, and then you can, a resident or patient can sign up for a telehealth visit if they do test positive, and then they go through that screening again. If they qualify for the medicine, it's actually overnighted to them via FedEx, or they can pick up their local pharmacy. So Curative has quite a lot of sites. They're not affiliated with us all throughout the county, and so they're also just an option out there as well. So that is it. I'm going to turn it over to Laura to kind of talk about just these one pages. And again, we're definitely always working to improve these. We want any feedback. This is a little bit in response to kind of getting a lot of questions about like, what are vaccine rates in our area? What is it overall in the county? What's kind of happening operationally in sort of vaccine and testing? So we're going to be adding testing to this, and then maybe that's sort of like a what's new kind of thing or what's coming along. So work in progress. This is the first one we put out. So we obviously want to offer up more nuances to it as we can for feedback, but we also will be working on some countywide ones, and I'll let Laura speak to all that.
Hi, everyone. So my name is Laura. I work under Trish as the manager over her quality and strategic planning branch. And we'll just briefly walk through these community one-pagers. Helen, are you able to pull those up?
Yes.
Great. Thank
Can
you
you
so
see
much.
them?
Yes. Yeah, so maybe if you want to zoom out a little bit and feel free to scroll through, I'll just verbally describe what we have. So as Trish mentioned, we started these community one-pagers last month. They were first shared last month for the month of May. We have 6 of the larger equity communities covered currently: Daly City, East Palo Alto, Half Moon Bay, North Fair Oaks, San Mateo, and South San Francisco. And then Helen, if you just want to zoom in to the top and slowly scroll through, I'll describe what the main sections are. So there are 3 main sections currently. At the top, there is vaccination rate data. We have each of these communities broken down into age brackets, plus we have race and ethnicity data across the county, as well as a comparison of the 6 communities with the overall county vaccination rates and the health equity quartile vaccination rates. And then in the second section, a little bit below, in the middle of the page, we have information on county operations. So for this first edition, it covered vaccination data at the county clinics for the past 4 weeks, as well as the schedule for the standing vaccination clinics for the month. And then in the bottom section of the page, there is kind of a what's new information about, upcoming eligibility in this case, or other announcements. So we've already received a bit of feedback and have some plans for the June edition. For the June edition, our major changes will be that we'll be trying to pull some of the county specific information into a county one-pager, leaving some more space for community specific information. So we receive many requests around slicing the community vaccination rates additionally, for example, by race, ethnicity, or we're looking at subgeographies like census block groups. So this that data element is under review by our epidemiologists within County Health. Since there are high margins of error for small populations, we want to make sure that what the data that we are releasing is meaningful and reflects actual disparities as opposed to, say, noise or error in the data. So hopefully we'll have some more detailed information for each community. I know that there's also been requests to add additional communities or other one-pagers focusing on race ethnicity groups, or focusing additionally on a targeted age bracket. So we're also reviewing that too for future editions to see kind of what makes sense to pull out and what we might want to highlight on each of those. So I think we definitely will be, in addition to the just overall county one-pager, have additional one-pagers with different focuses. We also, for the next edition, will be adding testing information. So immediately we'll be able to add our testing clinic schedules as relevant to these 6 communities and the recent testing numbers for those county sites, just like we do for the vaccination sites. And we've also had requests to perhaps incorporate data such as overall testing rates or positivity rates. So we're looking into that as well, that if we're able to slice, say, by these communities or other populations and see what we can put up there. So definitely a lot of moving pieces, and we are all ears in terms of additional feedback. So for all feedback that comes in, we'll kind of vet it with internal experts to see from a data perspective and everything, if appropriate to highlight on these one-pagers or elsewhere for folks. I think that's it. Please just, if anyone wants to speak up, or maybe time-wise, if you want to put feedback in the chat or send it to Helen and team, they'll make sure it gets to us.
And I did want to add that our county-facing, public-facing dashboards that track vaccination rates are also updated, and they are now covering both first and second booster data. So you can see on those public dashboards that the vaccination rates for first boosters are okay. The second booster is very low at this point. So, and then just a question came up on the chat just to kind of clarify. So the second booster right now is for 50 plus in those who are in any age immunocompromised. The federal government did change it from sort of a recommendation of you can get a booster if you're 50 plus to now you should get a booster if you're 50 plus. And in general, what we've discussed internally in public health is that if you are eligible now, you should get one now. If it's been more than 4 or 5 months since your first one, because we do expect that there may be a next wave in the fall, and that we would want to, potentially there'll be additional boosters in the fall. So just as a kind of more guidelines around who's eligible for the boosters at this point. All right, Helen, I think we're going to stop there and turn it back over to you.
Thank you all so much for those updates. I see lots of questions in the chat, so I'm going to go, and I want to be mindful that our meeting ends at 11. So I'm sorry we might not get to everyone's questions, but I'm going to go in the order that I see. I'm seeing, Colleen, you have a question for Dr. Chan about the test and treat program.
Yes, and Trish answered the question, so go on to the next one. Thank you.
Okay, perfect. And I think Trish, you also answered Caesar's question in the chat as well. So I think Ophelie, did you have a question?
Thanks, Helen. I do for Curtis. You mentioned that every 4 to 6 months, we will see surges that will last about 4 to 6 weeks. What has the county considered or talked about increased stress, chronic stress, high levels of cortisols due to these surges, and just needing to remask, needing to continue testing, needing to, additional booster? I wonder, it sounds like this is going to be indefinitely going on. Is there internal conversation in the county about when are we going to stop testing? When are we going to stop all the efforts regarding COVID-19?
Yeah, that's a great question. And I didn't put, I don't think I put, I talked about the every 4 to 6 months. That's certainly the pattern. And we do expect and continue waves. And we don't know, nobody knows how much the virus is going to mutate. In terms of internal and external questions about COVID, I think when I first came back to San Mateo County in October of 2020, I think the first health advisory I put out was actually in collaboration with behavioral health. It was about the importance of mental health, and both the impact of COVID on mental health, as well as the impact of mental health on people being able to follow guidelines on COVID. Now, I did that early on. It doesn't mean I couldn't that we can do a better job. And you're totally right that the amount of stress that these restrictions and the confusing guidelines, Cesar, it's a great question about. There is like one very unclear map that I could think of that I'll try to find that of like sorting through all the different like vaccines, like the boosters, who's eligible, when you're eligible next, is it 4 months, 5 months, or 6 months? It's very confusing. It's very stressful. And what I'm saying is like that, I think that's part of the things that you all, as the promotores groups that you lead, hopefully in Puente, is like to try to help community members balance that. Like we do want community members to be able to go to family events so that they can still cherish those times together. So I'll stop there and see if you actually have you might have a particular suggestion as well too, it seems like so. But thank you, hopefully.
Not a particular suggestion, just wanted to know. I think in the school district, also Pesqueira La Honda School District has been continuing doing COVID testing every week. And I know it's something that's just weighing on families and just people working, doing these things also. And just wondering if there is going to be, not necessarily an endemic, but an end to all the efforts that we're doing. And yeah.
So I think hopefully I can just address that. I know we're getting close on time, but briefly. So it's a really great question in terms of where are we as a county. And so we, county health, work very closely with the county manager's office and to sort of see what that future does look like. And so we are hearing from the county manager level at the EOC, which is the Emergency Operations Center that's been stood up since the beginning of COVID, may be coming to a close. And so that's just a signal that FEMA funding may be ending at some point. And so that's just, kind of it rolls from federal to state to local, but that's nothing like not tomorrow, we're looking probably sometime in the fall. So we are kind of looking at just our overall plans, like how do we manage this as an ongoing basis as a public health department? What is our role, in these efforts, and trying to make sure and to see what other resources there are. So the school districts and the county office of ed have a lot of sort of direct support from the state around their needs. We've checked with the shelters. They also have a direct CDPH, California Department of Public Health resource to be able to get like antigen test kits. So we're currently actively working at continued testing, sites, as well as how are we distributing testing antigen test kits, and we're working closely with OCA to distribute those antigen test kits via a resource with the state as well. So it's a great question, and we are exactly what you're saying, is we are looking at what does the future look like. I think I've learned that you can't plan COVID in more than about 3-month increments. No matter whatever I think I was going to do last year at this time, it didn't happen. So we'll definitely be looking to see what we'll be doing over the next 3 to 6 months, and then communicating that out with the community as possible.
Thank you. And now we're going to take one last question because I want to save time for our contracts update at the end. So the last question is going to be from Henrietta. Explain the difference between precisely what the vaccine does and what the treatments do.
Curtis, you get a short answer for that one, or you want me to try?
Yeah, why don't you go ahead? Sorry, I was like.
I mean, the vaccines are, I mean, this is I have a PhD after my name, but I'm not a medical in any sense, but the vaccine is preventing, right? So it's preventing severe illness and death in some cases, right? So it's a help to it's kind of reduce your ability, what you're going to end up with. The Paxlovid or the other treatments are a 5-day course, again, sort of to tamp down any excessive symptomology that you might have, so that you are not ending up hospitalized. So with the test to treat options, 65 plus is almost an automatic, to kind of get that, because we know that that's our highest risk for serious illness and death in COVID to this day, from the very beginning COVID to today. 65 plus is the highest risk that we've seen. We've seen the most deaths in our county around that population. So the test to treat is really to interrupt what COVID is going to do to your body. Vaccinations try to prevent you from ever getting that COVID.
So why couldn't the treatment be part of the prevention? Why does the treatment have to be given after the disease is already contracted?
I think that's a medical question. I don't think doctors would prescribe a medication without.
Oh, that's a great question. And Henrietta, you're so amazing. Yeah, that's actually in trials right now in terms of post-exposure prophylaxis. So yeah, it's possible that might be used, for example, in like the precisely for like the roommate and somebody in a nursing home, right? That would be a great candidate for post-exposure prophylaxis. It's not been licensed yet for emergency use authorization for that type of purpose, because I think for right now, I think if somebody who's frail, elderly, but vaccinated and boosted, and they get that medication within like 3 days, 5 days, it should be, it's highly protective. But great question. And I try to put a concise answer. Vaccine prepares your own immune system to fight the virus. Paxlovid stops virus replication. That's my concise answer.
Thank you both. So I'm sorry if we didn't get to everyone's question in the chat. If you have any follow-up questions, please feel free to email me and I will try to find the answer for you. I think everybody has my contact info. But now I also want to save time for just a quick 2 minutes for a contracts update. And Emma, are you on the call?
I am. Thanks, Helen. And thanks. It's so nice to see everyone. And there's great information. And, Dr. Curtis Chan and Trish and Laura, they put a lot of work into, really trying to, and we as a county, really learning from you, getting your feedback, and really trying to take this time to little, like Trish mentioned, to kind of pause and say, where are we at? Where are the priorities? And where do we need a shift? And so the health department, as they mentioned, is really going to use the next few weeks to kind of really just look at the data, better understand it, get your feedback, as you guys were talking about. I'm looking in the chat, what's happening at the census tract, what's happening within demographics, within race, ethnicities, communities. Do we need a target, Black American, Black in a certain zip code? Do we need to target Latinos in X, Y, and Z community, census tract, at what age groups, etc. Those are the details that the health department will be evaluating in the next couple of weeks and making those priorities, which will then help us go back to the community, receive some additional feedback, and really begin to pivot more and pivot into those specific communities. With that being said, we'd like to propose and like to move forward and extend all the agreements through the summer one of the things that Dr. Chan said is we're in a surge. It's critical now, and we're about to hit the 4th of July graduation season. So many things are happening, and we're going to continue to go through these surges, but right now we're at a very high surge. I'm sure, right now you can hear, and you're probably knowing more than one person that has been hit by COVID now. And so we want to be able to maximize and really tap into your expertise, your community, kind of trusted within the community, your partnership, and extend these agreements through the summer. So Helen will be working with you to extend each of these agreements through the summer. And if you have any questions, please let us know, but those should be coming shortly. But again, on behalf of the county, on behalf of OCA, and all of us and the residents, thank you, thank you, thank you. You guys have done a tremendous job, and we value your work, we value your feedback, and we value, more importantly, our partnership with you. And we know you're a critical piece to the success, and so it is critical that we continue this partnership, but we want to really also take this time to, also pause, look at the data, look at your feedback, and then pivot and really prioritize more critical to those areas. So thank you again. I'm happy to answer any questions, but I know we're 3 minutes over, so I apologize for that. And if I don't get to talk to anybody, happy Memorial Day, and have a great and safe weekend, please. And open the windows and enjoy the sun and be
Yeah.
outside.
Ventilate, vaccinate, and mask.
And mask up.
Thank you, everybody.
Thank you
Thanks.
all.
Thank you, everybody. Thanks all.
Thank you.
Thank you all.
Thank you.